Okay, so if you'll remember when Keely flexed forward, she had one segment at the bottom of her low back that did not flex as well as the others. That same segment, when she went into extension or leaned back, it actually kind of shot forward and she got kind of all of her extension at that one segment and not at the other. So I want to access the front of her spine at that segment to see if I can push that vertebra back a little bit down towards the table so it'll sit better when she flexes and extends. Okay, so we'll have less stress hopefully overall on that segment. Now, this can be a really tender technique for patients, so I try to be as soft as I can going into this area. So as I sink in through her viscera, through her abdominals, through her hip flexors as well, I can then in this area access the lumbar spine. All right, and I'm sinking down. Here I am, I'm on something that really doesn't want to move, which I believe is her L5, her lowest lumbar vertebra. All right, so now I'm figuring out which direction it's the tightest, and down into the left, this direction is the tightest. Now I'm going to see, can I bring a little bit more tension into that area? Is that too much, Keely, or is that okay? That's okay. Okay, so I'm gonna maintain that pressure and then bring her legs into it and figure out, that kind of puts less tension into my fingers, but if I bring her legs towards me a little bit, that puts more tension into my fingers, and you feel that, okay? Now I'm gonna say, don't let me lift your legs up, hold there. Good, I'm just maintaining that tension. And slowly let it go. And as she relaxes, I want to see if I can take up any bit of slack. And I can, just a little bit. Hold here, don't let me lift you up. Very good, and let it go. And I'm gonna see as I take up that slack, I can work a little bit more into that range. I'm not gonna do an entire treatment of this right now, just for the sake of time, but just know it's very important, very important component of my treatment is, if needed, I will treat through the visceral structures, through the hip flexors, and really ideally I would work on mobility of all of those first before I then go and access the front of the back, and specifically at L5 for her on this segment. So that's treatment of AP, anterior to posterior, of the lumbar spine.